There's a long history of diabetes in my family. So my grandfather was diabetic, my aunts and uncles, my mom, my dad, and all my siblings are all diabetic. I never got morbidly obese. I was never 100 pounds over. I was always like 60 pounds overweight. My problem was being diabetic, I became very insulin resistant. And I was taking 125 units a day. That's like 5-6 shots a day of insulin. None of that was helping. It kept getting worse and worse and worse. So I had heard about gastric bypass as a way to change metabolic function, and that it might even be a cure for the diabetes.
The Roux-en-Y gastric bypass. And this is the gold standard for bariatric surgery. It's also one of the procedures that we really use in patients who have brittle diabetes or have diabetes that just keeps kind of getting worse. This particular procedure allows for about 40% of complete remission of diabetes in some patients, and 42% on top of that 40% will see improvement in their diabetes. We do have 12% where we don't see much of a change, but in those instances we feel as though the pancreas has no recovery from the damage that has already been done. We actually create a very small pouch, about 5 to 6 centimeters in length and about 3 centimeters in width. Once we create the pouch, we go down to the small intestine and we bypass a portion of the small intestine. That's how it gets its name. So once we measure out the small intestine, we will actually cut the small intestine at a certain point, and the end that is further away will actually be attached to the pouch. The proximal end will be reattached further down. So in doing that, we create a restrictive portion, which means the patient can only eat a certain amount before they're full. And in creating a malabsorptive aspect to the procedure, we have a situation where even the small amount that they're getting is digested differently in a way that the body almost recognizes less amount of food. And so the patient isn't getting everything that they're eating. It's not being broken down in a way that it would have been broken down before.
The interesting thing is within 2 weeks after my surgery, my insulin levels dropped, so 600 units a day down to 30 units within 2 weeks of the surgery. And it has remained stable since then. I feel like a normal person because my body's functioning more normally. It's just been an all-around good thing for me.